This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician.
Hello and welcome everyone. My name is Ruth Ellen Sanchez and I want to welcome you all to Daily with Doc and Becca. This program is sponsored by dailywithdoc.com. And if somebody referred you to this program, please get back to that person as they will be your main point of contact. And today we have the amazing Pharmacist Ben Fuchs, and we're going to be revisiting and deep diving into the question of why are people afraid to take their supplements and their medication or prescriptions at the same time. So we have some really good questions on that. Pharmacist Ben is going to fill us in. And this program is for educational purposes only. It is not meant to treat, diagnose, or cure any diseases. And it is not meant to take the place of your primary care physician. Also, we do not make any claims regarding health or income. And as an empowered individual, you do have options. Also, if there is a testimonial, it is the experience of the person giving the testimonial and not a claim that we are making. So I'm going to go ahead and bring Ben on, who is...
Hi there. I just had to detangle here. I don't know why this always happens to me. I'm not even sure what to do about it. Is there a magic trick? Do you ever wonder why, like, you wrap your iPhone or your earphones in the drawer, and then like you open the drawer 2 days later and it's all a big tangled mess?
I don't know. Are there little...
Almost like a physics law or something. It's kind of crazy how that happens. Anyway, how's it going, Ruth Ellen?
It's going really good. How's it going with you?
Good to see everybody.
Yes, great to see you.
So this is an interesting topic. Don't you get frustrated when people say, my doctor said these are going to interfere with my drugs? Or when people ask, it's just a kind of frustrating thing for me because we have this kind of, this sort of dual way of looking at nutrition. On one hand, we look at them, and I don't mean by we, I mean the mainstream, especially mainstream medicine or the orthodox medical viewpoint on nutrition is, oh, it's just silly and, you know, it doesn't really work and there's no clinical evidence and all that stuff. But on the other hand, they're going to interfere with your drugs. They're so powerful that they have pharmaceutical effects that are going to counteract the medicines that we're giving you. So it's like, which one is it? Are these really strong enough to interfere with your medications? Or are they placebos and they don't really work and there's no clinical evidence and they're just like taking Skittles or M&Ms, right? Well, right. Obviously neither is true. And the fact is nutrients are not drugs and nutrients are not placebos. Body runs on nutrients and they don't act like pharmaceuticals. Pharmaceuticals command cellular responses. They order cellular responses. They tell the cell what to do. Nutrients provide the right terrain for the cells to do what they want to do when they want to do it. Now, which one makes more sense when it comes to a therapeutic intervention? To command, to order the cells to do things, or to provide the raw materials in an environmental fashion, in a terrain fashion, so the cells can do what they want to do? And that's obviously that's our perspective.
Yes, it is.
So then it comes to the interference aspect. Nutrients will not interfere with the drugs literally or per se, but they will create an environment that allows the drug response to be more effective. So to give a classic example, if you are taking a blood thinning drug, they'll tell you not to use vitamin K because vitamin K supposedly clots the blood and they don't want to have a blood clotting effect. Sorry, just 1 second, you guys. Hey, I gotta call you too, okay? Sorry, I had to do that. I was expecting a phone call. So,
Okay.
Vitamin K clots the blood, supposedly. It doesn't really clot the blood, but vitamin K clots the blood and blood thinners thin the blood. And so if you take vitamin K with your blood thinning drugs, supposedly what's going to happen is they're going to counteract each other. That's not what happens. Vitamin K does not clot the blood. Vitamin E does not thin the blood. Essential fatty acids don't thin the blood. And maybe we're a little guilty for saying that as lay people. We kind of confuse the matter by talking that way. It's not what happens. Vitamin E, essential fatty acids, glucosamine, they have effects that allow the body to thin the blood more effectively. Vitamin K has effects that allows the blood to clot more effectively. In other words, when the body needs to clot, vitamin K has to be present. No vitamin K present, it's not going to clot as effectively. But that's not the same as vitamin K clotting the blood. You guys, is that distinction clear? On the other hand, a blood thinning drug like Coumadin literally thins the blood, literally does not provide the environment, does not provide the raw materials, does not make it easier for the body to do what it needs to. It literally thins the blood. And the medical folks do not distinguish between those two effects. We have to distinguish between those two effects, providing the terrain. You know what I mean when I say terrain? That's actually a medical term, terrain.
Yeah, the internal part of the body.
No, the terrain, the ground, not the internal part of the body, the ground, right? So the terrain is where the plant grows from. The terrain, a good terrain will allow a plant to grow, a bad terrain will not allow a plant to grow. We're working on the terrain, the biochemical terrain, to allow biochemistry to proceed. But we're not, with nutrition, making things happen. This is very important because to make things happen is an arrogant command proposal to the body. You are going to do this. And I always give that story about Moses hitting the rock, because that's what I always think of. Moses hit the rock. He wasn't supposed to hit the rock. He was supposed to ask the rock. Medicine hits the rock. You are going to, the doctor or the medical professional saying, blood pressure, you're going to drop, whether you like it or not. Gallbladder, we're going to take care of you, even if we have to yank you out of the body. You understand? It's a different mentality. Whether this happened or not, it's at least legendary. Francis Bacon, who was the father of modern medicine, or modern science, one of the fathers of modern science, is famous for saying, and this is kind of legendary, I'm not sure if he literally said it, but the legend goes, he said, we will put nature on the rock and tear her secrets from her limb from limb. And this is the viewpoint that science and scientists had in the 1500s, in the 16th century, when science was getting going, and medicine is an extension of that. It perceives nature as being flawed. It perceives biology as being flawed. It perceives the body as being inherently flawed. And the only way that it can run is if we fix it. We don't have that perspective. Holistic practitioners don't have that perspective. Naturopathy doesn't have that perspective. Our perspective is the body's wise, much wiser than we are, and seems pretty self-evident. Yes, there's heart attacks that happen, and there's diseases that happen, clearly, obviously, but the body heals itself. Cells are capable of producing hundreds of chemical reactions a second with no intervention. So it seems self-evident that the body knows what it's doing, and the only interference that happens to it to keep it from running the way it's supposed to be is us. We've seen the enemy, and he is us. And medicine is an extension of that. And so when you ask the question, will nutrients interfere with my drugs? There's an implied assumption that nutrients are like drugs. They're not. They're the terrain. We're working on providing the right environment. That being said, by providing the right environment for the biochemistry to proceed the way we want it to proceed, This will make it easier for your drugs to work. If you provide the right environment nutritionally for the blood pressure, for the blood to thin, and then you take a blood thinner, you've provided the environment. Now you don't need as much blood thinner. Do you follow my logic here?
Yes, absolutely.
So nutrients make your drugs work better. In fact, they make it work so much better, you have to tell your doctor you're taking nutrients so you can lower your dose. And that's what we're looking to do, because what goes unspoken when we get on prescriptions, and there's people taking multiple prescriptions, most people are on, who are taking prescriptions are on multiple prescriptions. What goes unstated is they're poisons. Yeah. They're toxins. I'm not saying that to insult or to be pejorative. I mean, literal. Your body has to detoxify them, because they're toxins. So they have to get processed like toxins. So the less you take, the better you're going to be. So the physician should be saying, take lots of nutrients, and we'll just give you a little bit of medication just to make sure something happens. Or you're on medication, hey, I'm going to start taking supplements. Great, now let's lower your the dose of your drug. That's what we're looking to do. If you're on a prescription drug, your number one health challenge is to figure out how to take a lower dose and wean yourself off that drug. And the best way to do it is to fix the building, is to fix the terrain, fix the biochemistry. And that's what we're doing. We're fixing the biochemistry. We're not fixing it. We're providing the resources for the body to fix the biochemistry. And it's a mindset. It's a perspective that honors biology, that honors biochemistry, that honors the body, that honors divine intelligence. There's none of that in medicine. There's no honoring divine intelligence in medicine. Medicine has this underlying assumption that we're going to fix you. We don't need to be fixed. We need to be fed. And that's the message. So nutrients will interfere with your drugs in the sense that they'll make it easier for your drugs to do their work. And on top of everything else, and this is another point that goes unstated, when you take vitamin K, it's not just important for your blood, it's important for your bones, and it's important for your skin, and it's important for your heart. So you could say, oh, well, we don't want you to take vitamin K with your blood thinner. Now there's all the other systems all these other systems are going to be deprived of vitamin K. It's just doesn't make, it's so illogical. It's crazy. And again, I hate to having to talk without a doctor in front of me here. So I'm preaching to the choir. Let's get a doctor on here and let's talk to him, or somebody who supports the medical model, because I hope this makes sense. Is this logical?
It does. It makes a lot of sense, especially.
So yes, they're going to interfere with your drugs in the sense that you'll need less drugs.
Yeah.
Is the bottom line.
Yeah. Yes, that's very, very true.
Okay, good. So that's I get a little ticked off when I hear that. And sometimes they don't even say don't take vitamin K. They'll say don't eat broccoli, as if the only thing broccoli is going to do is affect your blood.
They literally tell you not to eat broccoli.
They'll literally tell you not to eat green leafy vegetables.
Yes, they do. Yeah, you're not supposed to eat spinach or kale or anything.
Right, because we want the drugs to work. Now, I will say the doctors are concerned that and this is just, CYA, they do have liability. They're concerned that because the effects of the drugs are analyzed very closely, they're monitored, they're parameters that the drugs have to operate within, and nutrients are not that compliant because nutrients are being shunted all over the body. So the doctors are afraid that we don't have enough control over the nutrients, like we have control over the drugs. Of course, nobody has any control over anything. You can't really control the drugs, but they feel like they have more control over the drugs, and nutrients will introduce a wild card into the biochemistry, and that's what they're concerned about, in fairness. But they're so benign compared to toxic drugs. Docs only look at one thing. They see everything as pharmacology. That's how they're trained, because they don't study nutrition. So it's not like they're bad people. It's not like they're dumb people. They're trained that way. They're trained to see every intervention that comes into the body as a pharmacological intervention, even if it's just food or nutritional supplements.
Right.
Okay?
Yes.
All right.
So what about the medication timing between your supplements? Like, how do you balance that?
It's occasionally you'll find some it's very rare, because nutrients are so, it's like food.
No,
nutrients
I mean,
like when you take your drugs with your nutrients kind of thing.
Yeah.
There's with some exceptions like antibiotics and probiotics, possibly, or or vitamin C and certain minerals possibly, or phytates or fiber in certain nutrients, or maybe some drugs that need to stay in the body a long time, and nutrients that facilitate digestion. Or absorption or elimination. For the most part, that's not a factor.
Okay. Very good.
For the most part, you can and should take your Mighty 90 essential nutrients every single day, even multiple times a day. There's no downside to it. None.
Yeah.
Only upside. And like I said, they'll only facilitate and improve the effects of your drugs. By the way, surgeries are another time when it's really important to take nutritional supplementation to get a better surgical outcome. So using your Mighty 90 essential nutrients, as well as things like your ultimate enzymes, which aren't the Mighty 90, they'll give you a better outcome. Using your healthy bone and joint pack should be automatic for everybody going through surgery. Everybody going through surgery should be on the healthy bone and joint pack before and after with the digestive enzymes. In fact, we should call the healthy bone and joint pack the healthy bone and joint and pre-surgical pack. That's how significant that is. Everybody who's going through some kind of surgical procedure will have a better outcome from their procedure if they're loaded with nutrition pre-surgery. As soon as the scalpel hits the skin, the healing process begins. So if you're loaded with vitamin C and calcium and magnesium and zinc, et cetera, the healing process can begin instantly. And that's when it should begin, as soon as the scalpel hits the skin.
Perfect. I agree with you. A friend of mine had to have surgery not that long ago, and she told them everything that she was taking, and the only thing they really said she couldn't take was the essential fatty acids.
And why is that?
Because of bleeding.
Because of bleeding. So they think in their minds, and it's silly, but that's how they think, that essential fatty acids are going to increase the likelihood of you bleeding.
Yeah.
All right. So, and when in reality, omega-6s and omega-3s balance each other out. So they're partially thin the blood, partially clot the blood, because inflammation and anti-inflammation go hand in hand. So omega-6s have a pro-inflammatory effect. Omega-3s have an anti-inflammatory effect, but that doesn't mean they'll cause inflammation or they'll stop inflammation. They make it easier for the body to inflame or make it easier for the body to anti-inflame. That's a very important distinction, to make it easier for the body to do what it wants to do versus making the body do what it wants to do. Hitting the rock versus asking the rock.
Yeah.
You know, your body is your baby. Love your baby. Be
and
kind to your baby.
Thing.
Yes. Because this body, you know, it's hard to really express how miraculous this thing is, how integrated and networked, and how responsive and intelligent it is. And from the cellular level to the organ level, it's just mind-blowing. And we really need to sit with that and honor that. And it would be very, not only educational, but inspirational to just think about your heart and what your heart does, or your intestine, or your liver, or your spleen. Just sit with it for 5 minutes. Just get on YouTube and do ask for an animation or watch an animation of how your liver works, and then picture this thing in your body. You know, partially, it's like we don't want to think about our organs, right? Like, do you want to think about your liver? Do you want to ever see your liver? Right? We kind of block it out. We sort of block it out because we don't think about it. You know, if you ever see the inside of your body, that's not a good thing. But to use your imagination and go into that and see how everything's embedded in this matrix, and it's all connected to each other, and how what happens on the, how does that go, AJ? A butterfly flaps his wings in South America, and somebody catches a cold in China. It's like it's all integrated. It's all connected. Every single iota, every single piece of the body is integrated with everything else, like a hologram. It's all one thing. It's just so miraculous and amazing. But because there's some kind of block that we have, we don't like thinking about it. It allows us to swallow poisons that will shut down cholesterol production or force our blood to clot or thin. In philosophy, there's this idea called absurdio ad reductum. Have you heard of that? Absurdio ad reductum. It's a philosophical idea that says you take the most extreme and absurd case to prove your point. Our idea that we can drug the body into submission to have it get healthier or somehow be healthier is absurdio ad reductum. It's the extent of the most ridiculous idea you can think of. And when it started in the middle of the 19th century with aspirin or what they called aspirin back then. I think pretty sure that was one of the early drugs. That was great, but it's got proceeded onto this crazy point where we're spending literally hundreds of billions, if not trillions of dollars on these things. People are on 5, 6, 10 medications, and it's getting worse every year. Are we getting healthier for all that? Ask yourself that. Are we getting healthier for all the medication we're taking, which increases every year? When I was doing my pharmacy stuff, it would not be unusual for somebody to take a plastic bag, an older person usually, a plastic bag, and throw it on the counter with 10 different bottles in there. And then they would go shop and I would fill 10 different bottles for the same person. And the situation has only gotten worse. It's absolutely absurd. Absurdio ad reductum. It's the most absurd case you could possibly imagine when it comes to health and wellness.
I agree with you. 100%.
And we're all responsible, by the way. All of us. It's not just the doctor's fault. It's all of us for participating in this. And there's probably people out there thinking, oh, this is just crazy hippie talk and blah, 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 new age, blah, 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 blah. Probably not the people who are on the call, who are on the call regularly, but there's a lot of people who think that this is just crazy talk. In fact, most people do.
Yeah. So we have a couple hands up. Would you like to take questions?
Yes, I would love to take questions.
All right, Mary, if you can unmute, I'm going to bring you on screen. And
hello, Mary.
Hey, Pharmacist
Hi, Mary.
Ben. How you doing?
I'm doing good. How are you doing?
Good, good. I was along with you filling all those prescriptions.
You are?
decades ago.
You're a pharmacist?
No, I was
No.
the pharmacist technician.
You know what I'm talking about, right?
Oh, of course.
A plastic bag with like 10 different bottles in it, right?
Yes.
And that was not unusual.
Not unusual. Not unusual. Okay, so let's get to some questions. I'll just take two. There's many, so I'm going to try to get it quick here. Mark has a question.
Yes. Hi,
Are
Mark.
there any natural remedies to help fight ulcerative colitis?
Oh,
And
yes.
he knows about reducing inflammation helps, but he
Well,
wants to know about remedies.
foods. The most important thing for any intestinal problem, ulcerative colitis, is it's not really a disease, it's a description. You got ulcers in your colon.
Yeah.
Ulceration occurs when there's toxicity in the colon, when there's changes in bacteria, so-called dysbiosis, or in response to specific foods. So the most important thing is food. Eliminate all the problem foods, liquid diet possibly, depending on how severe the ulceration is. Slimy stuff. So bone soup, bone broth is ideal. Aloe vera gel, fucoid Z, or maybe even ZRadical. Something to coat the ulcer is a good idea. Healthy digestion pack. Nightly essence. You got to be a little bit careful with the nightly essence. You want to start off slowly with probiotics, because if you have too much bacteria in the intestine, you can throw things off. So you want to start off slowly. I-26, of course. The Daily Digest is cool because it comes in a packet and you can take a bunch of different supplements all in one packet every day. So that's a good idea to use. Dr. Arias's Liver Cleanse is a good idea to use. There's a very important relationship between the intestine and the colon, or I'm sorry, the intestine and the liver, and then also strengthening the intestinal lining with collagen peptides, collagen, fucoid, and fucoid Z. Healthy bone and joint pack. The healthy bone and joint pack, as we talked about earlier, is good for the whole body. That's just the bones and joints, for the connective tissue. And there's a very important connective tissue component to the intestine. So ulcerative colitis in many ways involves deterioration of connective tissue. So healthy bone and joint pack. So there's lots and lots and lots of things to do. Most importantly is to stop the assaults on the intestine. And don't go by good food, bad food list, because there's a lot of good foods that can create havoc in the intestine. So you want to do a food diary and look for symptoms. Ulcerative colitis, any digestive issue, Crohn's disease, celiac disease, ulcerative colitis, whatever it is, all of it is reversible. The intestine and the skin are the two most, the cells of the intestine and the cells of the skin are the two most rapidly dividing cellular systems in the body. So they're designed to heal. Think about it. The intestine is constantly being assaulted, if you will, even from a healthy diet.
Yeah.
So nature has equipped the intestine with rapid cellular division. So yes, they can heal. You can never have ulcerative colitis again if you ever do that. If you do this correctly. How cool is that? You can never have to deal with this condition again. It's strictly a food condition. And so by modifying the way you eat and modifying the kind of supplements you take, you can do a lot. I highly recommend liquids. In addition to bone soup, vegetable juices. But you got to be careful with some vegetables. So you may want to make sure that you're doing the right vegetables. But between vegetable juices, bone soup, aloe vera, you can definitely help soothe and accelerate healing of the intestine. Vitamin A, by the way, is very important for intestinal health, for cell division.
Perfect. Unfortunately, many of our products can be in liquid form, so they can be taken much easier.
Glucogel caps too, or glucogel liquid, I'm sorry.
Yeah, liquid glucogel. Okay, perfect. The second one I'll ask is from Julia. She asks, I am almost 70 years old, type 2 diabetes and high blood pressure and neuropathy and knee ligament issues. What's the best diet and best vitamins and minerals?
Triangle of disease. That's the second point on the triangle of disease, which of course involves the first point, which we don't talk about a lot, but if you have a second point, you got to have the first point. The first point precedes it. So aside from the first point, which is all the digestive stuff that we just talked about, and remember, this is not something people really address, but we do on this program. So I'll say it again, even though we say it all the time. There's a very important connection between the gallbladder, the liver, and the intestine and blood sugar. This is how the first point becomes the second point. Bile is like a hormone that communicates to the blood sugar system, to the metabolic system. The intestine is communicating to the metabolic system. This is why GLP-1s affect the intestine. And that's why the most important side effects for GLP-1s are intestinal, because of the relationship between the liver and there's the liver, which obviously metabolizes sugars. So it's a short jump from digestive dysfunction to metabolic or blood sugar dysfunction. I'm not going to talk about that, but to strictly address blood sugar, look, how does blood sugar get elevated? There's only two ways. There's only two ways your blood sugar, there's changes are created in blood sugar. Number one, obviously food, and number two, cortisol, stress hormone. So between food and stress hormone, you have your two major leverage points. And I don't know if I talked about this last time. I think I talked about it on Coast to Coast. Because the body is a system, meaning the definition of a system is a bunch of parts that work together for one goal, and that's the body. Yeah. All the parts are working together for one goal. This idea of a system is something that has only been articulated and elucidated in science for about 70 years, since the 1940s. Before that, we didn't really have an understanding of what symptoms was. We had a sort of intuitive probably understanding, but from a scientific perspective, systems theory began in the 1940s. Today, we can take systems theory, which began from cybernetics and computers, and we can apply it to the body. We can apply systems theory and all the hallmarks and pillars of systems theory to biology and biochemistry. And one of the key hallmarks of systems theory is that all systems have control points, leverage points, bottlenecks, however you want to call it, but points where you can make a little twist and you can affect the entire system. Contrast that with how medicine looks at the body, which comes from, as I said earlier, the 15th century and 16th century, where all the parts were looked at as being independent. They weren't looked at as being part of a system. So if you had a heart problem, you had a heart problem. If you had a skin problem, you had a skin problem. If you had a bone problem, you had a bone problem. With systems theory, if you had a bone problem, you got a system problem. With a skin problem, you got a system problem. The old way, you got a bone problem, you got a bone problem. So the beautiful thing about systems is it allows you to leverage these control points. The major control point is what comes into the body through the mouth, and that's food. So for our friend, what's her name? Or this gal that wrote?
Julia.
Food. The less you eat, the more stable your blood sugar system is going to be. The less calories you ingest, the more stable your blood sugar is going to be. The less foods you ingest that spike your calories or spike your blood sugar, the more stable your blood sugar is going to be. So stay away from foods that are fast burning, highly easy to process. Fast food, processed food, ultra processed food is engineered to be easy to process. There's no ultra processed food that you have to chew a lot, for example, right? You have to chew a food a lot. That's usually a natural food. Fast food, ultra processed food, it goes right down your throat. It goes right in your system. These spike your blood sugar instantly. Foods that have lots of fructose, fruit sugar, high fructose corn syrup, same thing. Sweets, beverages, sweet beverages, I should say, they're the worst. And that includes fruit juice, the worst, but especially sodas and what they call soft drinks, right? You're better off having a hard drink than a soft drink from a metabolic perspective. Yes, you are, really.
Yeah.
You know, not that a hard drink's great for you either, but the soft drinks will kill you slowly. Fatty liver disease is an epidemic now, largely because of our dramatically increased ingestion of fructose, not in fruits, but in high fructose corn syrup. Healthy blood sugar pack for our, what's her name? Say her friend.
Julia.
For Julia, healthy blood sugar pack. In addition to the healthy blood sugar pack, before every meal, or at the start of every meal, I should say, make sure you're eating protein and vegetables. Have your bread and have your sweets and have your anything that spikes your blood sugar after you have your protein and your vegetables. In the middle of the day, do a fiber drink. Grind up flax seeds and put it in water and drink it. And that will fill you up. And so you'll be less likely to snack.
Mm-hmm.
Nutrients that are important or products that are important or helpful, aside from the ones in the healthy blood sugar pack: ultimate niacin, ultimate selenium, ultimate MSM, CFX, zinc FX. These will all support blood sugar metabolism. Osteomag, all support blood sugar metabolism. So you have so many different ways, so many different. It's so ironic to me that the leading cause of death in this country is blood sugar, elevated blood sugar. Now, there's two major causes of death: cancer and heart disease, that if you look at the statistics come before diabetes as a cause of death. So diabetes is technically the third leading cause of death, but both cancer and cardiovascular health or heart disease is a form of diabetes, is a form of dysglycemia, messed up blood sugar. So all our health challenges, our long-term health challenges, have a major blood sugar component. And it's so ironic to me because that's the easiest thing to correct. The easiest thing to correct from a physiological perspective, maybe not from a mental perspective or a psychological perspective, because we love our sweets and our brains are programmed to feel pleasure when we eat high-calorie foods, when we eat what they call hyper-palatable foods. They actually literally call them hyper-palatable, super tasty. When we eat these kinds of foods that give us a big payoff, a big caloric payoff, or a big pleasure payoff, how are you going to tell somebody not to eat their Ben and Jerry's? You know, when you get this kind of pleasure sensation. So it does require a certain amount of willpower, a certain amount of discipline, but there are hacks you could do, like the nutritional hacks that we talked about. The B vitamins in particular, and the Beyond Tangy Tangerine can be a nutritional hack. Drinking more water, just drinking more water can be an important nutritional hack for type 2 diabetics, or even type 1 diabetic, or everybody who's dysglycemic without being diagnosed. Drinking more water will dilute your sugar, dilute your blood. So your blood sugar concentration will drop, especially first thing in the morning.
Got it. Two follow-ups on that. One, you said eat as little as possible. Is there a minimal amount?
Everybody's going to be different.
Calories, let's go that way. Or macronutrients needed.
No, you don't want to think that way. Everybody's going to be different. But every single study that's ever been done on longevity has shown the less you eat, the longer you live. Obviously without starving. Sure. There are nutrient sensors in every cell that will sense nutritional status, the amount of nutrients that are present. And you're going to hear more about this as time goes on, because they just kind of discovered this about 30 years ago. There's actually a molecular complex in cells called mTOR. Have you heard of this? Molecular target of rapamycin, mTOR. You're going to hear more and more about this over the coming years. mTOR is your major nutrient sensor in the body. When mTOR senses there's nutrients, macronutrients, mostly macronutrients, mostly sugar, it will turn on cell chemistry. In other words, from an evolutionary perspective, that meant it was summertime and it's time to grow. You got plenty of food. You just ate a woolly mammoth. You just ate a saber-tooth tiger, whatever it is you ate when you were a caveman. So the mTOR senses there's resources present. It says, let's get going. Let's make connective tissue. Let's make collagen. Let's make the cells divide. Let's start moving. This is obviously makes sense for the body. It goes to sleep when there's not nutrients present, and it revs up when there are nutrients present. What we have done over the last 100 years for economic reasons, unbeknownst to us because we didn't understand biochemistry 100 years ago, is we've created a food system that's designed to drive food into human bodies. You know, sometimes on Facebook, they'll show you pictures of people at the beach in the 1960s and 1970s. Have you seen this?
Yes.
Compared to people on the beach now. Or they'll show you people walking in New York City in the 1920s compared to people walking in New York City now. You see the difference. And this is what's happened over the last 40 or 50 years. In our lifetime, it's become an epidemic of obesity, an epidemic of excess calories, and excess calorie-driven health challenges. One of the things that happens, by the way, when mTOR is activated, is the body will start pumping out cholesterol. And, you know, our medical folks, because they're not biochemists, they're clinicians, will say you got too much cholesterol. Let's shut down the cholesterol production. Not why is the cholesterol production so high, but cholesterol is high and there's lots of cholesterol. We're just going to knock it out. That's the way they think. Cholesterol, elevated cholesterol, is a classic sign of the cells thinking there's plenty of resources and it's time to make stuff. Cholesterol is a fundamental building block for making things, right? So the more calories we ingest, particularly from sugars, the more mTOR, the faster mTOR is going to, the more efficiently mTOR is going to kick in, and the more cholesterol and other substances you're going to make. This is why slowing the body down, calming the body down is your most important strategy for health and longevity, particularly if you're sick, particularly if you're not, if you're dealing with some kind of chronic health challenge. Slow everything down.
Got it. Perfect. Thank you
And
so
by the way,
much.
what nutrients allow you to do is allow you to get torque versus speed. You know, on your bicycle, you can put it up to, you put it to the first gear, you get speed. You can turn the wheels really fast. But if you go down to 10, you get torque. So one push gives you much more power. You get to move more per push. We want torque, not speed. You get torque from nutrition, micronutrients particularly. You get torque from micronutrients, micronutrition.
Perfect. Thank you so much for that answer. I'll turn it over to either Ruth Ellen or AJ.
Thank you so much, Mary. AJ, you have your hand up. I'm going to bring you on. And if you could unmute, that would be awesome.
Pharmacist Ben, how are you today?
I'm good, AJ. Good to see you.
Good to see you as well. And a lot of people really appreciate what you do every day, but in particular on Coast to Coast, they really appreciate hearing from you.
Thank you. I'm glad I'm appreciated. It's nice to be appreciated.
Yes, you are well appreciated. You know, I have a woman named Sally, locally in California, dealing with I don't know if this word is accurate, Cameron lesions, elongated, flattened ulcers, bleeding at the crest of the stomach folds, large hiatal hernia problem, colon looks okay, except for the fact that there's mild diverticulitis, 6 since last year, too high of a risk to have surgery. She's got to lose some weight first. Shortness of breath, difficulty walking.
All right, you can stop right there. MBFA, classic MBFA. Cameron lesions, they're just ulcerations, basically stomach ulcerations, and that's what's happening. Her whole digestive tract is ulcerated, but she's also got weight problems, so chances are she's dysglycemic.
H. pylori?
I'm sure H. pylori is involved, absolutely. And then she didn't mention it, but she's probably got problems sleeping, and she's probably got jitteriness and anxiety and all the cortisol issues as well. What does that scream out to you there? Digestive problems, blood sugar problems, adrenal stress problems.
Well, besides the triangle disease, it reminds me of metabolic syndrome. But
well, it's the second point on the triangle disease. Yes, it's metabolic syndrome, absolutely. So the same thing. And
proton pump inhibitor.
Okay, that's just a drug that stops her body from making acid, just doctor nonsense. She may need it, you know, because acid's obviously going to cause a problem, but acid will also keep her from absorbing her minerals and her B vitamins and breaking down her proteins and activating her enzymes. So, you know, this is just the doctor mentality. And I'm not blaming doctors because that's how they're trained. See problem, fix problem, right? That's not how it works. You don't see problem, fix problem. You got to see problem and backtrack to where the problem begins if you really want to help. But that's not what we do. Look, we're going to the doctor. The doctor didn't come to this lady and say, "Let me help you." She went to the doctor. So you get you get whatever the doctor does. You know, it's like you know, one day I don't have a lot of time. Remind me to tell you the story about the moth who goes into the podiatrist's office.
And what did he say?
He says the moth goes into the podiatrist's office and he starts talking about his problems with his feet. And he says, "Oh my God, you know, I can't walk." And you know, the moth says, "My feet hurt," and this, that, and the other. And the podiatrist says, "I'm a podiatrist. Why'd you come to see me?" And the moth says, oh, no, I'm sorry. The moth goes in the podiatrist. The moth starts talking about a psychological problem. Says, oh my God, my Mrs. Moth left me, and my little moth kids are mad at me, and I lost my little moth job. And the podiatrist says, why are you coming to me? I'm a podiatrist. And the moth says, the light was on. I know, I messed up the joke, but that's kind of like that. We go to them. They don't come to us, you know?
Okay.
So we go to them. We're going to get what they treat us. Listen, to help this lady, work on the digestive system. Rewind. I'm not going to repeat it. Just rewind what we just talked about with the digestive system. You see how these things repeat themselves. There's nothing special. Only specialists think there's something special. There's nothing special. It's generic. The body breaks down in a predictable pathway. You know, sometimes somebody will tell me a couple things about their health, and then I'll tell them about their menstrual cycle, or I'll tell them about their sleep issues, or they'll tell them about their fertility, and they'll say, how did you know that? Because it's a pattern. It all repeats itself. There's nothing special about how the body breaks down. It's generic. And that's why the mindset is so important. But we don't believe in ourselves, and partially it's because we're taught not to believe in ourselves. We're taught to trust other people. That's why I always harp on this idea of authority. You want to be your own authority. Longevity is about being your own doctor. Let's play doctor, right? This is what doc was all about. Do it yourself. So for this gal, her body's falling apart, largely at the first point, based on what you said. Now, she also has obesity issues, so there's metabolic issues, I'm sure. And like I said, she didn't mention cortisol, but I'm sure there's sleep problems, anxiety issues, depression, and all the things that are associated with cortisol. Foods, food diary. We got a food diary at criticalhealthnews.com. Everybody who's dealing with a chronic degenerative condition or multiple chronic degenerative conditions, download that food diary and start doing the food diary and link your health issues with specific foods. Then eliminate those foods. And then you do all the digestive stuff we just talked about, and then get on the blood sugar stuff that we just talked about. Go ketogenic, low calorie, low sugar, etc. It's as simple as that. Healthy blood sugar pack, Fucoid Z, I-26, Daily Digest, Ultimate Enzymes, apple cider vinegar, or even better, Beyond Tangy Tangerine. Drink your Beyond Tangy Tangerine with your Ultimate Enzymes. Drink Beyond Tangy Tangerine with your meals. You'll get better absorption of your Beyond Tangy Tangerine, and you'll mitigate some of the digestive, the bloating and cramping and diarrhea that occurs sometimes with Beyond Tangy Tangerine. When you take too much, you can mitigate that by having food. That'll slow down the release of the BTT, and it will help you digest your food as well. So there's all of these wonderful strategies that you can employ. Here's the good news. The sicker you are, the faster the turnaround begins. So for those last two questions that you asked me, you can turn this around today, after this call, during this call. Between cigarettes, your lungs start to heal. Between assaults to the body, whatever those assaults are, your body heals. Between meals, your intestine, your diverticulitis, your Cameron lesions, they will begin healing. So as soon as you stop putting the assaults into the body, the healing process begins, especially if you have nutrients in there.
Understood, Pharmacist Ben. And I feel bad for people. They call in, they don't feel like they have any hope.
Yeah.
They feel overwhelmed, so they will
go
and they'll get the temporary fix.
Yes.
But long term, use this show is titled, use your nutrients alongside with your medication, and hopefully soon you won't need your medication.
Work with your doctor, work with your physician. Don't let him tell you not to take the nutrients. Say, I am going to take the nutrients, doctor. It's my body. I'm going to take them. I'll let you know what I'm doing. We'll monitor everything. It's your right to take nutrients. Don't let anybody tell you it's not in your health interest to be on a supplementation program. That's not true. That's blatantly not true. So it's your right to do that, unless you're in a hospital, I guess. If you're in a hospital, they own you. You can't do it then. But at home, it's your right to do that. Just tell the doctor, I'm going to work with you, but I'm taking my magnesium. I'm taking my vitamin E, my EFAs, my whatever it is, my Osteomag or BTT or whatever. What? Tangy Tangerine, exactly.
Pharmacist Ben, and by the way, and just, how important the food diary is. Everyone should go to Critical Health News, sign up for the newsletter, and get a copy of the food diary. And then you want to call 855-949-3377. Talk to the team, because we have a tool that I created that you can utilize to help you analyze the food diary based on what Pharmacist Ben and Dr. Wallach have taught us. Pharmacist Ben, see you Monday night.
See you Monday night. What, you're going or I'm going?
Ruth Ellen, you're muted.
Thank you, AJ.
Why did he say see you Monday night? Why would he?
Because he's left the screen and Phyllis has her hand up and he may not come back on screen until the end.
Okay, gotcha.
So.
Okay. All right.
All right.
I thought he was kicking me off.
No,
Okay.
no, we still have, 15 minutes with you.
All right.
So we're going to try and get as many questions as we can in.
One time I had this job working for this guy and he was an older guy and he wanted to be real. He was really sweet. He was really nice, but he wanted to fire me. And his way of firing me, he goes, when I left one day for I go, well, I guess we won't be seeing you around these parts anymore, Ben. That's his way.
That's terrible.
That's how he fired me.
That's not right.
We won't be seeing you around these parts. He's such a nice guy. He couldn't fire me.
Oh my gosh. I cannot believe that. That was just
I know.
mean. Oh my gosh. All right. So let's go ahead. Well, and thank you for all you do.
Well, you're cracking me up between that and the moth.
I ruined the moth joke, but it's funnier than I made it.
It was still funny.
All right.
Okay, so we have a couple of questions from Repulsify on YouTube.
What? Repulsify?
I know.
What
Great
a terrible
name.
Repulsify. All right.
All right. Well, so for number one,
yes.
He asks, what do you know about AKG?
What do I know about AKG? Okay, what's the next question? I'll tell you about AKG in a second.
All right. So he says his hairline is receding from the corners. He started that male pattern baldness. His appendix, he got his appendix out when he was 10.
Well, there you go. You got the problem right there. And a lot of kids who have their appendix out are going to be dealing with well, first of all, they're going to be dealing with intestinal problems for the rest of their life, but they've also had intestinal problems that preceded their appendicitis or their appendix removal. The appendix is a little tiny stick, a little tiny tube that comes off of the intestine. And for the longest time, they didn't know what it did. They used to, when I was in pharmacy school, they used to call it a vestige, meaning it's just some useless piece of flesh that's in the body that there's no purpose for. But then they realized that that's where all the bacteria are. And it turns out that the appendix is a warehouse or a storehouse for bacteria. So without an appendix, you're going to be dealing with dysbiosis for the rest of your life, unless you take care of yourself. And then preceding the appendix, if he had appendicitis, I assume he had appendicitis, he probably had dysbiosis before that. So this is a guy who has long-standing digestive health issues, or long-standing digestive health issues. What was the question about it? Did he have a question about
he asked about his hairline receding, but he also mentioned, talk about the dysbiosis. He's 209 pounds, 5'10", and he has brown circular marks on his skin, which does that relate to the digestion?
Absolutely, 100%. The skin and the digestive system are like two peas in a pod. The digestive system is the skin inside out and vice versa. The skin is the digestive system outside in. They communicate to each other, and it's almost impossible to have a skin condition that's not a digestive condition. There are some local things like gluten allergies or nickel allergies or latex allergies, but even then a case could be made that the skin is sensitive because of digestive issues. So you want to pretty much assume that a skin problem is a digestive problem. And I'm saying that as somebody who's been studying skin and skin issues for 40 plus years. It's almost impossible not to have one related to the other. The hair problem is a follicle problem. When you have hair loss, you've got follicles that aren't feeding hair. The follicles are lined by, like any other part of the body, like by cells. So it's a cellular issue. To the body, the hair doesn't matter. To us, it matters. But to the body, the heart is way more important than the hair. And the spleen and the liver and the intestine and the lungs and all the internal viscera are way more important than the hair is. So under conditions of nutritional deficiencies or toxicities, all the resources are going to be diverted from the top, from the extremities into the center, the viscera, the core of the body. So until you get that straightened out, you're not going to be able to deal with your hair. You can't deal with it directly. So the body doesn't give a rat's you-know-what about your hair. The body is much more concerned with your survival, and hair has nothing to do with your survival as much as we like hair. There's also the issue of hormones. Testosterone and insulin are major players in hair loss. Obviously, if this guy is 5'10" and 209, he's got some insulin problems and likely has testosterone problems. So you can't, and this is also true for men who have ED, or men who are starting to lose their masculinity as they get older, or men who are starting to lose muscle mass or weaker as they get older. Think insulin, elevated insulin. Once you have elevated insulin, it's a very, very short jump to deficiencies, or at least functional deficiencies, in testosterone and androgens and male hormones. Think insulin. How do you lower insulin? Lower your calories. It's a well-known fact that anabolism and muscle building can be accomplished by calorie reduction, not nutrition reduction, but calorie reduction. Bodybuilders know this. You know, before contests, they'll fast. They won't eat, so they can get cut up. So work on your insulin. There's a major connection between elevated insulin and hair loss. It's part of metabolic syndrome, as Ruth Ellen could tell, or as Rebecca could tell us if she was here. So think insulin resistance. Remember, we're boiling this down to the control points. The control points are the three major control points are the digestive system, the blood sugar system, and the adrenal thyroid complex. The two major control points, if you want to simplify it even further, are the digestive system and the metabolic system, period. Now, as far as AKG goes, that is cute. You got way bigger fish to fry than AKG. AKG, by the way, is a molecule that's involved in energy production. Alpha ketoglutarate, they call it, or AKG. Bodybuilders will sometimes use it. They'll use it to reduce health problems. Don't fall for it. You got way bigger fish to fry than AKG. And anybody tries to sell you AKG doesn't know what they're talking about. You need your B vitamin. You need your essential nutrients. Remember, we call these the mighty 90 essential nutrients. What does that mean? That means without them, you're dead. That's what essential means. Sometimes people will say, oh, essential means your body can't make it. You got to get in your diet. It's more fundamental than that. Without it, you're dead. That's what it is. Or if you don't have enough of it, you'll suffer from a disease. Most of us are in that category, unless perhaps present company excluded, because we're all hip to supplementation. For most people, they're going to be deficient in the essential nutrients, not enough to be dead, but enough to be suffering from health challenges, from deficiency health challenges, even if they're not diseases. That's your fish. Those are the fish you want to fry. AKG is way down the list on important things to do. It's cute. Don't waste your money. Get on the Healthy Start Pack.
So besides cutting back on calories and getting the essential...
healthy blood sugar pack.
Mm-hmm. What about upping his protein?
You know, that can help, but especially before meals, because that will help him reduce his sugar intake. Eating more protein is a great strategy for reducing your sugar intake, because protein will get converted into sugar. Protein gets converted into sugar. This is, by the way, one reason why sometimes people wonder why they're not losing weight when they go paleo or they go high protein. And they'll notice that their blood sugar isn't changing significantly, or they're not losing weight. And that's because protein does get turned into sugar relatively efficiently. So you got to be a little bit careful with the protein. However, protein will give you slow release of sugar. It's not so much the sugar that's the problem, although that's the problem too, but it's the fast release. That's what they call the glycemic index. The high glycemic index sugars are the ones that get released really fast into the bloodstream. Boom, they spike the blood sugar. The body doesn't like spikes. The body likes to be just level, maybe a little bump, and then level, a little bump. When you eat, a dessert or a soda or fruit juice, boom, your blood sugar goes up. With protein, the blood sugar stays stable. You get a little bump as the protein gets metabolized and sugar is released gradually. That's how you want to treat the body. Kindly, lovingly, pet the body. You want everything calm with the body, relax with the body. It's the spikes that are the problem.
Well, I'll sign off by saying the body wants to be just right.
Body wants to be just right. And thanks for doing our book, Phyllis. Thanks for, I really appreciate that.
It's just been a joy so far.
Thank you.
Thank you, Phyllis. And Mary, I'm going to go ahead and bring you on. There you go.
Okay, I'm back.
Thank you.
Okay, we have a few more questions. Hopefully we can fit in to the hour. One from Ellen: how to rebuild or strengthen knee cartilage?
Same thing as everything else. Healthy Bone and Joint Pack, first of all, obviously. The knee cartilage is joint. The cartilage is the part of the body called the connective tissue. Mm-hmm. And without, to simplify things, so it's not all weird and scientific and, biological, it's just stuff. The body's made of 4 kinds of stuff. I know probably people have heard me say it before, but it bears repeating. The body is made up of 4 kinds of stuff. Technically, stuff, the word for stuff is tissue. The 4 kinds of tissue, but I call it stuff. You got the covering. That's called epithelial tissue. Your skin is epithelial tissue. Your eyes are epithelial tissue. Certain glands are epithelial tissue. That's the covering tissue. Then there's electrical wiring. That's the nervous tissue. Then there's the flesh robot, the part in the middle that's underneath the covering. The flesh robot, when you see a flesh robot, if you've ever seen the bodies exhibit in the museums, you can't tell whether the flesh robot is a Chinese person or American or an Indian or a black person or, or yellow or whatever. The flesh robot is just connective tissue and muscle tissue, and that's who we are. That's the bulk of who we are. Everything else is just covering and wiring. That's the part of the body that deteriorates maximally as we age. Everything deteriorates, but maximally, that's the part that deteriorates as we age. That's the part that we go to have plastic surgery for, or we go to have tummy tucks for, or we go to have all the cosmetic kinds of surgical interventions that we go to the plastic surgeon and the physicians for, because that's the part that causes the most distress. The muscle tissue and the connective tissue, this flesh robot, if you cut it this way, like a cross section, you get steak. A steak is muscle tissue and connective tissue. The gristle and the white part, that's the connective tissue. The red part is the muscle tissue. The connective tissue feeds the muscle tissue. The connective tissue feeds everything. So if you want to do one thing to anti-age, it's build connective tissue. If you want to do one thing to age gracefully, painlessly, disease-free, build the connective tissue. The connective tissue is made up of protein fibers. The most important one is called collagen, and mush. And that mush is like jelly. The mush and the jelly are called extracellular matrix. And this extracellular matrix is actually a combination of the mush and the jelly plus the fibers. That's the part of the body you want to focus on for anti-aging. The cartilage is a classic example of that part of the body. So everything you can do. By the way, this was Dr. Wallach. Before Dr. Wallach was the mineral doctor, he was the connective tissue doctor. That was his first thing. He called it the pig pack, or he called the product the pig pack, right? Remember the pig pack? I think we probably still have the pig pack. So the pig, what is the pig pack, and why does he call it the pig pack? Do you know why it's called the pig pack? What is it about the pig pack? AJ, why is it the pig pack?
Connective tissues in it.
But why pig pack?
Because he couldn't call it a human pack.
No, it's not. That's true. But why you pick a pig? Because when you eat connective tissue, that gives you the raw materials and the signaling molecules for building your connective tissue. Yeah. So he called it pig pack because it came from connective tissue of a pig. Okay, you can have connective tissue of a cow. You probably aren't going to eat connective tissue from a human, but you can have connective tissue from animals. This is why indigenous cultures always eat the organs. We eat the muscle. When we eat meat, we love the muscle. That's what steak is. It's the muscle. We get rid of the connective tissue, but the connective tissue, eating the connective tissue, the pig's feet, the snouts, the tails, that's all the connective tissue. When you eat connective tissue, you build your connective tissue. He called it the pig pack because it had connective tissue from a pig. And so it built your connective tissue. So eating connective tissue is job number one. Now, you don't have to eat directly. You don't have to eat, organ meat if you don't want organ meat or bone soup, bone broth. By the way, bones are connective tissue. I was just reading an article just earlier this week about how building bone is not about calcium. It's about building connective tissue, which we've been talking about here for years. The bones are connective tissue. The blood is connective tissue. The vessels are connective tissue. So eating connective tissue, but you don't have to necessarily eat the connective tissue. You can eat your collagen peptides, or you can eat collagen. So that's another thing. That's another way to go. You can eat the building blocks of connective tissue. One of the most important is glucosamine. So your glucogel caps. And what you'll find is once you start eating all these, not only you're building your cartilage, but you're building your fascia in your face. So you get less wrinkles. You're building your joints. So you get less arthritis. The connective tissue feeds all the cells. So every one of the cells of the body is going to be healthier. The connective tissue detoxifies. So building connective tissue is the sine qua non, the very essence of anti-aging is building connective tissue. Focus on that connective tissue. You can't build connective tissue without your Beyond Tangy Tangerine, specifically vitamin C. So make sure you're on your Beyond Tangy Tangerine as well. anything you can do to build connective tissue, healthy bone and joint pack, and of course Beyond Tangy Tangerine's in there. I throw in collagen peptides, hydrolyzed collagen, TMR. TMR is awesome. We haven't talked about TMR in a while. That stuff is awesome. Oh yeah, for blood sugar, we talked about eating more protein. Start your meals off with TMR. Get some almond milk, unsweetened, a banana, and a couple scoops of TMR shake. Holy cow, is that delicious? Crack a raw egg in there if you want more protein, even more delicious and healthy for you. Start every meal off with some TMR shake. Your body will love you, and Stan and Laura will love you too.
Yes,
no doubt about it. No doubt about it. Thank you. Thank you so much. It sounds like I need to turn this over to Ruth Ellen.
And I do have to bolt here.
Yes, it is the top of the hour. Thank you so much, Mary.
Thank you, everybody.
All right. Thank you, Pharmacist Ben.
Nice to see y'all.
We'll see you next week.
Okay. Monday, AJ.
Yes, Monday.
Okay. Bye.
Bye. Thank you. Thank you for joining us, everyone. It was a very informational packed show. We got lots of questions answered and some really good information in the beginning. And I'm grateful that we were able to get all those questions answered, because sometimes we run out of time. So if I can get my team to come up and join me on the screen, and I got to remember. There we go. All right. Thank you, everyone, for joining us today. If your question did not get asked or answered, please email us at questions at dailywithdoc.com. Or you can call if you'd like to speak with a certified holistic health coach at 855-949-3377, and somebody can help you. And also, if you're working with somebody, please make sure to get back with that person, because they'll be your primary point of contact. And also, this program was for educational purposes only and not meant to treat, diagnose, or cure any diseases or replace your primary care physician. So I want to thank everyone who came and joined us today. Thank you for that. We love it when we get people coming in and able to share information with you. And I want to thank everyone who helped support the show, starting with Mary. Mary is out there on the different platforms, bringing in questions and helping in the background here on the Zoom. So thank you so much for all that you do, Mary. It's greatly appreciated. And then we have Phyllis, who is also doing that, but she's also helping to share the platform on the platforms in different areas. And she is also responsible, her and her husband, Andy, for getting Doc on the radio. Otherwise, none of us would probably be here. So thank you for all that and so much more, Phyllis. And then we have Marilyn, who is Miss Speedy Fingers. And is one of the benefits of being here with us on Zoom is she is typing away and lots of information to read. So thank you, Marilyn. You're awesome. And then we have Albert, who is joining us from South Africa and is the person that will answer the phone in the middle of the night when the rest of us are sleeping because it's daytime to him. Thank you for joining us, Albert. I know it's late at night for you, so thank you. And also, he is the gatekeeper and lets people in. And if you have a phone number, he takes part of the phone number off to guard your privacy, which is very important to us. And then we have AJ, who does too many things to mention. He is our digital marketing director, and he just does so many things. And we are very grateful for him. Especially, we enjoy Pharmacist Ben Bites on Monday night, so join us for that. And my name is Ruth Ellen Sanchez, and I am the executive production manager of Daily with Doc and Becca. And I do a lot of things, and I love what I do, and I love my team, and I love everybody. And Rebecca, we miss you. Also, just remember to be kind, because you don't know what somebody's going through. And also, it's very important to respect people's wishes and privacy, and not push and keep pushing if they ask you to stop contacting them. So please stop. Anyway, we will see you all next week. We have some great guests next week. So have a great and beautiful weekend tomorrow. And if you are part of the Institute of Holistic Health, graduation is tomorrow at noon. Email us or text us to find out where to go if you don't already know. Thank you so much, everybody. Have a beautiful day. Bye. AJ.
Well, that was an opportunity. I mean, you mentioned the Institute of Holistic Health graduate.
Oh, I'm sorry. Yes. If you're interested in being a coach, please go to coach.dailywithdoc.com and there's information there and you can join all of us and be a coach. Thank you for that reminder, AJ. Thank you. Have a great weekend, everyone.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor.